Today we'll be talking about truly our most vulnerable creatures, the teeny tinies that they go downhill very quickly, and so you have to act quickly to treat them and prevent them from dying.
Okay, so I'm first going to talk about kittens, the medical intake. Of course, like what Dr. B just said earlier, you don't want to wait for these little guys. A lot of people want to be like, oh, they're too tiny to have medication. Well, while you're waiting, they're dying, usually from some kind of medical issue. So you want to make sure if they're 5 weeks and younger that you're doing, we recommend penicillin on neonates. As you can see on this slide, it's a 6-to-1 dilution, 1 part penicillin, 6 parts LRS. And we have it dosed out for you so that way you can do in between the grams. We also want to make sure you do dextrose or sugar water, Caro, as soon as they come in. We don't know how long these kittens have been out in the wild or without their mother. So you want to make sure we go ahead and get that blood sugar up immediately. Also, if you see any fleas present on the kittens, you want to make sure you do praziquantel for tapeworms. And if pale gums, start anemia protocol, and of course, every kitten needs a heat source. Snuggle Safe Disc, non-auto shut-off heating pads, those are the best. Rice socks are great for like transporting, but they only last for about 30 minutes. Also, if you're using a non-auto shut-off heating pad, of course, you're gonna have to turn those things on every 2 hours. So you wanna make sure those are 2 key elements there.
And then for kittens that are 6 weeks and older, we recommend vaccines can be given safely starting at 4 weeks or 1 pound. If you're unsure if they're 4 weeks, go with the 1 pound rule. And that's every kitten. It's every kitten in your shelter. No kitten goes by without that vaccine. It's very important because if you have Panleuk, if you're not vaccinating every single kitten, you're gonna have an outbreak. So 4 weeks, if they're in foster, at Austin Pets Alive, they're going into foster homes. We don't have them come back in at 4 weeks to give that vaccine. Just make sure they're staying in their foster home, but get them in at the 6-week mark. If they're in your nursery or exposed otherwise, then we say go with the 1 pound 4 weeks as early as possible to vaccinate. Check their gum color, it's very important. They could have flea anemia, they could have intestinal parasite anemia. So if their gums are white or pale, you want to make sure you alert the veterinarian right away because anemia is obviously life-threatening. So it's a very simple, just quick lift of the lip, make sure they're nice and pink. Check for any obvious wounds, signs of illness, what we call wet tail. A lot of times if you look at their tail or their hind end and it looks like it's been wet, that's a sign of diarrhea. So if you see that, then you need to make sure that you're addressing diarrhea, even if you're not seeing it in that span of intake. We do start dewormer at 2 weeks of age. So we go with Pyrantel. It's pretty generic, it's cheap, you can get it pretty much anywhere. And then we give it every 2 weeks on the vaccine schedule. Flea prevention is very important. The neonates, you guys use Capstar and neonates. If they're 6 weeks and older, then we just go with whatever we use. We kind of bounce between Frontline and Vectra, but you want to make sure you're getting some sort of flea prevention on them. And then microchip on intake.
For puppies, it's very similar. We want to make sure that the puppies that come into our population are taken, very close looks at. We want to make sure that we're looking at their gums. We want to make sure that we are giving them a meatball. A lot of puppies come in, they're scared, they're lethargic. We can't tell if it's because they've been on the animal control truck. Are they just nervous? They've just gotten taken away from their mom. Let's go ahead and give them a little bit of a canned food meatball. Puppies love to eat. If this puppy's not going to eat, we need to be concerned about parvo. So it's really, really important. We also want to make sure that every puppy coming into our shelter 4 weeks and older is receiving a vaccination. Deworming is very important. We all know that the puppies can die of diarrhea, can be caused by the worm, so let's go ahead and get that dewormer on board for them. Flea meds, obviously, heartworm prevention only if they're 6 weeks and older. We want to make sure that we're using modified live vaccines, and we do that at 4 weeks and up. And if they're born in foster, it's okay to wait until they're at least 6 weeks old. But again, if they're in your shelter, let's do this at 4 weeks. We actually at Austin Pets Alive, if they've been born in care or have been exposed to a shelter, are doing it as soon as birth, especially if you're in a distemper exposed area. That is different than kittens. Kittens do need to wait till 4 weeks and one pound. But if it's a puppy, let's go ahead and make sure that we're protecting them from distemper right away. Bordetella at 6 weeks as well. And Jordana's going to talk to you about recombinant versus, are you going to? Okay, Dr. B is going to.
So there are the two vaccines that work really well, but they have different onsets of action. So modified live works much quicker than the recombinant vaccine, even though the drug representatives will say it's an amazing vaccine, and it is. It could take up to 2 weeks to work or up to your second vaccination. So that's why the modified live is preferred over recombinant.
One thing to kind of just hit real fast, that meatball test is super important. If you can meatball test every puppy on intake, just offer them a small, tiny meatball of pedigree, Alpo, whatever you have laying on the shelf. A healthy puppy will eat it. If the puppy's not eating that meatball, it's sick. It's sick with something. The first thing you should probably do is parvo, but we'll talk about that in a little bit. But just meatball test every puppy on intake.
If the puppy's under 4 weeks old, we want to make sure that we're giving it a dose of Pin-G on intake. Penicillin G is just like what we were talking about in the kittens. We're going to do a 1-to-6 ratio. The Pin-G starts to help attack the bacteria in their belly. A lot of puppies can come in, they're coming in, straight off the mom. We don't know what they've been exposed to. So it really does help create a barrier to, or a recovery to any kind of bacteria in their gut. So we want to go ahead and make sure we've got Pin-G on board if it's under 4 weeks. We also want to make sure that on intake we're doing dextro or Cairo syrup. We don't know how long it's been since this puppy ate. We don't know how long it's been since mom said, no, thank you, I don't like you anymore, or I'm going to find my own food, you're on your own, or somebody came across it. So we want to make sure that we're really giving them the best medical care immediately upon intake. Go ahead and attempt to feed it a bottle or gruel so you kind of know what type of situation you're looking at. Do I need a specialized foster? Do I need specialized medical care for it? Also check for wet tail. That's usually the sign of really watery diarrhea that we need to go ahead and start treating immediately. Also keep these puppies away from all other dogs in your shelter. This is your most vulnerable population in your shelter for your dogs.
Wash hands, all of us.
Everybody.
Please wash your hands.
So there's
I did notice there was a decrease in the soap in the bathroom, so everybody is washing their hands. So
Yay,
that's a
good job,
thing.
guys.
So one thing to also note, so PPE, when do we wear gloves, gowns, all of that stuff? So we are firm believers in washing hands. Gloves were not really meant to prevent spread of disease among dogs and cats. They're meant to protect ourselves. And if we can't feel our hands are dirty, or if your staff can't feel their hands are dirty, they're more likely to not to go grab something else. If they're wearing a glove, they're touching the puppy, and then they're opening the refrigerator, and they're getting the medication, and they're touching all of that stuff in between. Kittens don't have to be held against you necessarily. You can handle a kitten without getting it up on your clothes and contaminating your clothes. So maybe not gowning up for kittens, but definitely consider gowning up for puppies. That you kind of have to bring them to your body, to hold them, to restrain them, to do all of that stuff. And if your intake staff are holding every dog against their bodies, and one of those dogs had parvo, you've just exposed all of your intake that day. So kittens, not necessary to wear gowns. Puppies, I would consider it. Gloves can be helpful, but you really kind of want to put your focus on washing hands, and it's much cheaper than gloves. Contact time for disinfectants, they all kind of have slightly different contact times. Look at whatever you're using. As a general rule of thumb, 10 minutes is going to kind of cover all of them. But definitely you don't want to just be spraying and wiping and then getting the next one, because that contact time is really important.
And can I say one thing about gloves and kittens? Kittens are going to shred those gloves. If you're feeding that kitten, it's going to shred those gloves, and it's going to contact your skin anyway. So we recommend our volunteers, if you really want to wear gloves, that's fine, but you're taking them off in between every litter, and you're still washing your hands in between each litter. So that's just expense coming out of their pocket, basically.
We also want to keep this population away from others. So this means no puppy rooms, no congregating in lobbies, no wellness clinics for these animals. Wellness clinics can be done as a drive-through clinic for these type of animals. ISO areas, the Parvo, Panleuk, places like that, those are hot spots. Let's make sure that these vulnerable babies are not anywhere near that. We have a lot of people that I talk to that tell me, oh, well, we have a puppy room, and we don't understand why we have to shut that puppy room down every 7 days or every 14 days. It's because you have a puppy room. Do not have a puppy room. Let's go ahead and put puppies in with long stays, not in the kennels with them, but mix them in your rows of long stays. Your long stay animals are your healthiest population. They're your long stay because they're healthy and they've been there your longest. So let's make sure that we just stop all the puppy rooms. Also, any puppy under 5 months old should not be walked. I also have people tell me, well, I put them outside on concrete and I think my cleaners bleach in between. Thinking does not work. We have to absolutely guarantee that these puppies are not commingled with other puppies that could have parvo, could be shedding parvo. We also really, really want to make sure that they've got minimum age and vaccines to even enter proper kennel areas. So if you have a 2-week-old puppy, you're obviously not going to put that 2-week-old puppy in your general population. Same thing even with a 4-week-old puppy. We want to make sure that we're keeping our vulnerable population very safe and secure. That's when you pick up the phone and you call a foster, you call your rescue, you ask a staff member, hey, who has an open spot in the corner of their office, anything like that. These puppies do not belong in your general population at all.
And that's something that, just real quick, we kind of learned the hard way. So we at Austin Pets Live, we think we're always doing everything right, but that's not necessarily true. So after Hurricane Harvey, the whole state was seeing a lot of distemper. We were seeing a lot of distemper, and we had some puppies that were getting sick, and we were thinking, well, we think we're getting all the places that they could be spreading disease. But one place that we didn't think about was our wellness clinics. You know, we have these puppies come in, they're healthy puppies coming in for just quick booster vaccines. They're not sick, we're not suspicious of anything, but it's something that we had to go back and say, well, that could be somewhere that's an issue, so let's just, they're not eligible for those types of events. Vaccine requirements. So we do have vaccine requirements for surgery, for offsites, for even entering our medical clinic. If we have any animals that are under, well, you can probably read the fine print, but the point is have vaccine requirements. There should never be an animal coming into your surgery clinic. A puppy shouldn't be going in there without any vaccines, because we all know sometimes dogs break with parvo on the table. Then what? Entering the clinic is a big one. We don't want puppies entering our clinic because our clinic, for the most part, we're seeing sick animals, and we're seeing new animals, and so we really don't ever know what any animal is incubating at that point. So really think about having vaccine requirements for whatever works for you guys. Ours are spay, neuter, off-sites, entering our clinic. They have to be a minimum age and have a minimum number of vaccines on board. Car appointments are huge. We love car appointments. They're a little bit awkward at first, I'm not going to lie, but your people will get used to them. So we don't even want them stepping foot into our medical clinic. Stay in your car. That's the safest place for that animal. And it really does kind of just make the exam easy, right? We don't have people coming in, they're not waiting in the chair. And then we're worried about adult dogs that are interested in them and cats getting scared of dogs sitting next to them. So definitely do look at car appointments. Don't even let them come into your clinic. Especially anything contagious. If we know this puppy has an upper respiratory, if we know this puppy has ringworm or this cat, just let them wait in your car. It's pretty easy to do.
Yeah, and I think a key thing to remember, especially in a clinic setting, but even in the shelter setting, is like Panleuk and Parvo is everywhere, and possibly distemper. So just don't think that just because you bleached a room, it's not there.
Yeah.
You know, hopefully it's not, but it probably is somewhere.
Yeah, and a benefit of it is it really expedites foster appointments, because people don't really want to wait in their car very long. And so it kind of forces the whole process to go a lot quicker. Staff want to be quicker to get out there, and fosters don't want to, the chatting tends to decrease, so you can get them in and out a lot faster. You do need to figure out a way of how to make sure you're not forgetting people in cars, because that's a thing. That was a lesson that we learned. Have a system in place so people aren't waiting in their cars and then they're getting forgotten about. But car appointments have probably been one of our biggest resources and tools that we've used to prevent spread of disease in the clinic. Have a no cuddle policy. So we have this throughout our clinic because, especially on spay neuter. So spay neuter is our time where like it's a day that healthy puppies and kittens are coming in. We have volunteers that are helping. Staff are guilty of it. They're cute, right? They're cute, and our reaction is to want to touch them and pet them. But have a no cuddle policy. We don't let people touch our newborn babies, so let's just not let them touch our puppies and kittens. Reduce infection that way. Washing hands immediately before and after when people are touching them is really important. Again, washing hands is the number one thing you can do, but really kind of implement a no cuddle policy and make it just all the staff is aware of it, all of the volunteers are aware of it, somebody's verbalizing it to volunteers so that we're not just getting mad at them when they are touching our puppies and kittens. So parvovirus. So kind of back to the meatball. If you see any suspicious puppies, there's times I'm just walking at Austin Pets Alive and I see puppies in a kennel. They look they're in the back, they're not very active. Offer them a meatball. Just run, get a can of food, throw it in there, and see if they perk up, come up, and start to ravenously eat it. If they do not ravenously eat it, parvo test them. That's pretty much the first thing that we do. A healthy puppy and kitten will always eat that treat. I wouldn't use human food. I feel like a lot of times they just don't know what it is. It doesn't seem to have the same effect, but that can of food is a pretty good indicator. If they're scared, I get asked this a lot. Well, what about scared puppies that are kind of shut down anyways? If you just kind of hide for a minute, they'll come out and eat it and then go back to their corner. But you have to just kind of just walk away for a minute or two. Only use SNAP tests. Something we learned the hard way, those cheaper tests just are not as good. We're seeing a lot of false positives. So this is one place we do say spend the extra money and just use that IDEX SNAP test. We do group test litters though, right? If we have a litter of puppies, test one, test maybe two. Really all you need to do is test one though. If that puppy's positive, the rest are exposed and we treat them as a group. Direct exposed puppies, group tests, save you lots of money. If you do have a puppy that tests positive in your kennel, don't shut that kennel down. A lot of shelters want to shut it down for 3 days or 5 days or 7 days. It's always some arbitrary number that doesn't really mean anything. Don't shut it down. Do a deep clean. Obviously, we want to make sure that we're getting all of the virus out of there, but put a long stay in there. Put an adult dog in there. I would be a little bit hesitant to just throw another litter of puppies in there, but definitely don't shut it down. Just move an adult dog into it and open up another kennel for puppies. I'll let Dr. B talk about the rest of this.
Yeah, so a lot of, especially veterinarians, aren't comfortable with parvo puppy that just tests negative and putting it out in general population and with other puppies because it's thought that the shedding continues of the parvovirus for up to 4 weeks after. And what we have found is this does not occur. So we will literally take a parvo negative puppy that just turned negative, bathe them out really well, clip their nails, scrub their nails, get them out and put them with other puppies that are, they've only had one vaccine maybe or 2 or whatnot, and we have not seen it transmit to them. So we have pretty much evidence in our mind that it's not contagious that way and they don't shed. So don't be afraid to get that parvo negative puppy out into your general population. And then as far as exposure to break, sometimes we do get puppies that are exposed. They may not be positive themselves, but their litter mates are. We consider them exposed and we will treat them for parvo and quarantine them. It generally takes 3 to 5 days as long as they're really exposed. So they're in the kennel with the poop, with the other puppies. We're not separating them and saying, oh, wait, we don't want them to get parvo and get them away from the poop because then they might not break until later on if they're exposed, say, at day 4. So we want to keep them with the litter, treat them as they are, parvo positive, and then really monitor to see if they have symptoms. And if they have symptoms, it's most likely parvo, and we treat them as such.
And again, when you have your parvo puppies, if you're doing individual tests, you have some positive, some negative, don't split them up. Then you have to find 2 spots for those puppies now, when before it was just 1. They're directly exposed to each other, so your best move is going to be to keep them together and move them as a group wherever they need to go, whether it's in foster or a Parvo ICU. Just keep them together. Don't split them up. In the 10 plus years that we've been treating Parvo, and once they test negative, we bathe them, we kick them out. We have not been able to trace back another puppy breaking with Parvo after that negative test. So just something to think about. Another thing, so 5-day minimum exposure time. So from the day that puppy is exposed to Parvo, 5-day watch period. If they have not broken by day 5, they're healthy, they're eating, they're totally asymptomatic, clear them. They're most likely not going to break. I won't say they will never break, because we can't predict that. Every puppy has a different immune system. But I can say that in 2019, we treated over 800 puppies. We probably had 1 to 2 outliers that did break on like day 7. But those 1 to 2 puppies, we can't we can't do our whole Parvo ward trying to prevent those 2 puppies from breaking. Those 800 puppies mean a whole lot more to us. Panleuk. So who gets tested for Panleuk? So we're looking at history a lot. If they're under 4 months of age, vomiting is a big indicator. At some point, every kitten has diarrhea, so that's not necessarily a good way to judge who you're going to test. But vomiting plus or minus diarrhea is a huge indicator. And look at the history of the kitten. Is it new to your shelter? Has it been exposed to Panleuk before? You want to use your just IDEXX SNAP Parvo test. That's what we use. It works great. No issues, but again, stick to that IDEXX SNAP test. You want to isolate your Panleuk kittens and any exposed kitten. Foster is best. Foster is absolutely 1,000% best for Panleuk. They can get around-the-clock care. They can get around-the-clock force feeding, which is super important to kittens. Exposed kittens, so Parvo, our exposure time our watch period is 5 days. Panleuk is going to be 7 days. They get a little bit longer time to break if they're going to. So do a 7-day disinfection, and you want to disinfect. It's huge. Panleuk just seems to like to hide in nooks and crannies. Throw away what you can. If it's disposable, just get rid of it. Bedding, just get rid of it. You want to really be very careful with how you're sanitizing afterwards. Treatment, we do recommend injectable treatment. They're vomiting and diarrhea, any oral treatment just isn't going to be super effective. Again, foster is best. Show a foster how to give these injections. We tend to think that fosters they aren't able to, they can't learn how, we can't trust them to do it. We can absolutely trust them to do it. Fosters are super smart. We just have to give them the tools and the education, so let them do it. Feeding and supportive care is key. A few years ago, our Panleuk survival rate wasn't super great. It was about 50 to 60%. We would get Panleuk kittens and be like, this, it's not going to end well. And then Cassandra was like, well, you're not feeding them.
We're waiting 24 hours before feeding, and they're just,
yeah. So even within our own organization, we weren't doing the things that we know we should be doing. But feeding and care. If you can, I am convinced, after we started the feeding and the care per our nursery guidelines, our save rate shot up above 90%. It's incredible. I'm convinced if you can only provide feeding and supportive care, you can save a lot of Panleuk kittens versus providing the medications and not doing the feeding and the care. It really is a deal breaker. Serenia, I'll let you talk about Serenia.
So back in 2012 was our Panleuk year of hell. And so we was trying all the donated meds that we were getting to our kittens. And unfortunately, if you can't stop the vomiting within 24 hours, they were gone. So we realized Cerenia is basically the only drug that you can give, and it will prevent the vomiting if you do it once a day. We tried all the other things, and they would vomit right through it, which once again, you can't feed a kitten if it's vomiting, and if more is coming out than going in, you're just going to lose your babies. I also like to say one thing. If you're saving parvo puppies, you better be saving Panleukopenia kittens. That's all I want to say. It's exactly the same thing. You can stick them in the same room. You can feed them. I mean, the big thing is like parvo puppies. Puppies are more food motivated than kittens, right? So you're going to have to force feed your kittens no matter what. Even if they don't have Panleuk, sometimes they're like, I don't want that, so you still have to do that kind of thing.
We had a conversation about this before the class. Shelter saving parvo puppies, but euthanizing Panleuk kittens.
I have set up 2 nurseries for people for saving kittens, and it turned out to be parvo wards because it turned out to be exactly the same thing. The quarantines, everything is the same. So anyway, yeah, if you're already treating a kitten or a puppy for parvo and you have Panleuk, it's basically exactly the same treatment. It's 5 days worth of treatment. If you have a foster that has Panleuk in their home, guess what? You can't foster no more. So you might as well just foster these kittens that you have in your home. Or foster post-Panleuk kittens, right? The ones that have already been through the treatment. I take them for 5 whole days. Yes, I treat them, they're done, they're out of here, right? I get a new batch, right? That's how your Panleuk volunteers should, or your fosters should be. So yeah, anyway, I just want to say if you're saving the puppies, you should be saving the kittens. It's the exact same drugs, it's the exact same duration of treatment, it's the exact same quarantine.
And survival rate.
And survival rate, yes, it's really amazing. And puppies and kittens can't transfer it back and forth, so yes.
No, so we don't do IV treatment for Panleuk kittens. It doesn't increase their survival rate. It's not what they need. Don't do it. Just do sub-Q treatment on them. Clearing kittens, and same thing with parvo puppies, about 72 hours after their symptoms subside, test them. Once they're negative, bathe them and kick them out. We don't put our post-Panleuk kittens back into our nursery just because our nursery is full of vulnerable kittens. So those post-Panleuk kittens really do kind of need to go to foster or adoptions if they're of age. So neonates do not belong in the medical clinic. This is one thing that drives me crazy. Age is not a disease. They don't need to be in there just because they're young and they need to be bottle fed. It's actually the opposite. The clinic is usually too busy triaging other things that they forget about the neonates. And before you know it, it's been 6 hours and nobody's looked in that kennel to see how the kittens or the neonate puppies are doing. We have a very strict rule at Austin Pets Alive. Neonates do not stay in the clinic. Somebody has to be waiting for them. Transporter is waiting. Foster is waiting. And even at that, they're waiting with the foster, so we're not ushering them back into the clinic, and the foster is waiting up front. We really want them to stay with that person so that person can make sure that they're warm, make sure that they're not hungry, all of the things that most clinics don't have the time or the ability to keep up with.
And I just want to add, we also have a fading protocol that the fosters know about, they're trained in, so that if a kitten is fading, they start the protocol, then they call us, so that if they get the kitten back and it's stabilized, then they could bring it in, because at that point we can't do anything more than what they're doing, and chances are we don't have the time to sit there with a kitten warming it up doing fading protocol, so it's best with them anyway. But we still want to know, because once they're back stabilized, then we got to figure out why they were fading, and do they need antibiotics, what's the reason they're not eating, and all that.
So again, it all goes back to your fosters. Empower them, let them do that work for you so that you don't have to. Because again, with neonates, medical staff isn't necessarily doing anything special with these guys. They're much better off in the hands of that individual person who's dedicated to them.
All right, kittens with URI. So once again, yes, little bitties. If they weigh 150 grams and it stops eating, that's our worst fear, right? We want to stick a bottle in their mouth and just want them to suck, and then we just weigh them and it's all good. Well, if they have upper respiratory infection that you don't treat right away, say you hear sneezing and you're like, let's just wait a couple of days. Then what happens? Their nose gets congested and then they just give up. They're like, I don't want to eat anymore. So you're putting more resources into a kitten if you wait a long period of time to start medication. So as soon as you hear it, go ahead and start the medication right away. As you can see, we have different triage levels. The most important thing is you do not want to wait your full 7 to 10 days before you take your kitten back in. So if I have a kitten that's still sneezing on day 5 and has super runny discharge of nose and doesn't look any better, you're just wasting time administering that medicine until its full duration. So you want to make sure you go back on day 3, 72 hours, and say, hey, this is not working. They do not have time to wait. Once again, kittens are not food motivated like puppies are. Their will to live is not as high. They're just like, I'm done. So little drama queens. So we definitely, yes, yes. So we have to make sure that, we're on top of their medical. So upper respiratory infection is the biggest thing. Azithromycin, if you've not been buying that, I would go ahead and stock up on that. That's going to be your number 1 drug you're going to use for upper respiratory. And then I'll let Dr. B maybe talk about Clavamox or...
Sure. So definitely do not use Clavamox.
Yes.
Every private practitioner out there will recommend it. A lot of vets, that's one of the only antibiotics they have being worked out. Like I've relieved at other clinics and I've said, okay, do you have azithromycin? They say no. We have Clavamox and that's what we use. And it's so... You can use amoxicillin, you can use the generic form of amoxiclav if you want, but Clavamox does not work for upper respiratory, and we have not found it, helpful especially in neonates whatsoever. So if azithromycin isn't working, then we're going to take the next step up to Baytril, again, because this population is so at risk of going downhill and dying, and sometimes they do need Baytril to really hit whatever that infection is that's inside of them.
It's very much the exact same protocol for puppies as well. Again, Clavamox isn't going to work. Convenia is not going to work. Let's start out with the doxycycline. It's really important. I've gone to shelters and they tell me, well, I've let it be on the doxycycline for 7 days and it's not getting any better. Don't wait for the 7 days. If we're at day 3 and we're not seeing any signs of getting better, let's go ahead and move to the next stage of the protocol. So we want to make sure that we're really watching what's going on. Also, if this puppy comes into you and its eyes are closed, it can't breathe, and it's coughing, that's beyond a level 1. You need to look at what the symptoms are for your levels as well to decide which point of the treatment you begin with. So it's real important that you pay really close attention. It's also important that your team and your fosters, it's also really important that your staff and your fosters understand what to be looking for. Sometimes they'll tell me, well, the puppy's just not any better at all. But you start asking the questions, well, yeah, it did eat a little bit yesterday finally, and it did drink a little bit finally. So you want to be watching for any kind of progress so that you can determine if it is actually getting better or worse. So you really want to make sure that the fosters have symptom trackers that have very clear, defined specifications on there with input of food, output of feces and urine. Did they show any kind of energy level increase? Did you have to force feed today? Any of that kind of stuff.
I think something important to mention is knowing the symptoms of distemper. So in the super young population, you're probably not going to see it, but you might see it in the 6-week-old area. But the discharge around the eyes, when they have really thick discharge around both eyes, that's one of the main indicators. If you see that, I would highly suspect distemper. It's usually going to be with other upper respiratory signs, but that is one of the key things we see.
We call it the ring of crust.
Yeah.
Sorry. Okay, yes, kitten diarrhea protocol. So to me, the miracle drug is Pen-G. I know everyone's phones are out right now for the kitten diarrhea. Really? Is that a shock? Kittens have diarrhea? Oh my God. So penicillin, to me, the 6-to-1 dilution is going to be your miracle drug for bottle baby kittens that are on milk. You will see within 48 hours, the poop will literally start forming up on you, and it's just great. So anyway, if you're not using penicillin, you should be using penicillin. Once again, it's not straight penicillin, it's a diluted mix, 1 part penicillin, 6 parts LRS mixed together. And then we have a dilution per grams of weight. Also, if you're not weighing your kittens in grams, you should be, because 28 grams in an ounce, if a kitten has to weigh, if it weighs 150 and it loses a whole 28 grams before you even know that it's sick, it's going to be dead by that time. And then you guys are going to say what? Failure to thrive, or oh, it was just congenital or something. No, you just weren't weighing it properly and didn't see that it's losing weight and something needs to happen. Usually if it's losing weight, that means it's not getting enough intake, which means it's not getting the minimum of 5%, or it has diarrhea or something else happening that the foster or we're not noticing. Yes, so penicillin's my favorite. We have these tiers as well. How to, after 3 days, once again, if you start your penicillin and after on day 3 it's still just watery as ever, you're going to bump it up to the dewormers next, the penicillin and the marquee paste. And then after that, if it's super severe,
Panicure.
And then you're going to go to your Metro after that tier. Once again, we're not waiting the full 5 to 7 days. As soon as it's not getting better, we're going ahead and we're adding more into that.
And a big indicator on both of these, so the puppy diarrhea too, if you notice a common theme of all of these protocols is they all have very clear time indicators. After this many hours, after this many days, we switch it up. That needs to be very black and white because if it's not, your staff aren't going to know what to do, and they're all going to be doing different things. So it really, that time indicator is huge, whether you're looking at upper respiratory, diarrhea, or even different other illnesses. So make sure that you're documenting at what point do we switch antibiotics, at what point do we do something different. And that time, whatever point makes sense to you guys, it needs to reflect the urgency of the situation. So don't be waiting 7 days if your 4-week-old kitten is having watery diarrhea. And so just something to consider, but those time indicators are very important.
Yeah, they can get dehydrated really quick because the diarrhea is mostly water. So that's what you have to remember, and that's a lot of the weight loss that you're seeing when you're weighing them and they're losing weight, even if they're eating. So remember that.
And here's an example of a diarrhea tracker. The kitten protocol and the puppy diarrhea protocol are very similar. The puppy protocol, we do break it out by age a little bit, but we still hit them with PING first and then go at the trifecta of all the meds.
Okay.
But this diarrhea tracker is super important for your fosters and your clinic workers to be able to indicate what is our poop looking like.
The next one's Kitten Nursery, preventing disease spread. So these are kittens that are not vaccinated, right? So you do not want your people. A lot of places are like, oh, we have an area for our kittens. We hold them and then we get them out. But the staff who's mingling with all the adult cats and all the adult dogs and all the intake, they are the people that keep going in and out and touching these kittens, right? These animals that they're touching have been vaccinated. So if they are exposed with something and then we go in and touch all them and hold them up to us and then go into a neonatal area and touch them, they can catch Calisi, Panleuk, whatever these other guys are vaccinated against, correct? So the big key is you don't want anyone touching these kittens unless they are the beginning of the day, basically, check them first, or with protocols in between, wearing your smocks, wearing clothing, changing in and out, things like that. So basically, yeah, the big thing you want to do is since your kittens are already going to be vulnerable, you want to make sure that you're not preventing disease spread. And who's going to be spreading that disease? We are. So that's on us. We got to make sure that we're washing our hands. We're not holding kittens up against us while they're sneezing and urinating all over us and then grabbing another kitten and handing it to us, right? So we do have a system for all intakes. They all are intaked, looked over. If we do, when we talked about Panleuk, if we're pulling from a shelter that we know has Panleuk, and they come in and I open the box and I see diarrhea, I'm going to test them before I put them into my population of other unvaccinated kittens. We also do all in, all out, which is basically once everything goes into that room, it stays in that room. That way you can have certain nurseries set up privately. So that way if one room breaks with Panleuk, I don't have to shut my whole operation down, right? Nothing has came out of that room into any other room, so I can safely shut that room down, continue filling up the other room as they shoot them out to foster. So that's very important if you do have a nursery that you're not going in and grabbing supplies and bring them into another area. That way you can keep exposure to a minimum. Isolation area, I know a lot of places want to have a sick room and a healthy room for kittens. What does that do? You have a sick room and then it gets healthy. So you're removing an animal from the germs and bringing those germs into another room that you say healthy. What happens if a kitten in the healthy room breaks sick? What are you going to do with that one? Oh, ping pong it back to the sick room, right? Well, then those germs are already in with the healthy ones. So how we do in the nursery, we have each cage as they're sick. Each cage gets cleaned in between each one. If I pull them out and feed them, I'm cleaning everything. I'm smocking up, I'm washing my hands in between each one. Because these guys, we get 2-hour deadlines, right, to pull these guys from our shelters. What if they have ringworm in between this toe right here? Who is gonna see that, right? No one's gonna see that until days later. So we're preparing for the worst because kitten season is chaos. How do you control chaos? Well, this is how we're trying to control it. Trying to be prepared before it hits. And then of course, training is immensely important. If you have one bad egg, it's going to spread like wildfire. So you want to make sure every year that you're updating your training to your people and letting them know that they need to be on board, and these are the important goals that you're trying to reach.
We kind of talked about that.
Yeah, so I kind of already went into the kitten diarrhea protocol. Don't wait, they will die. And if you have problems with your vets not wanting to prescribe meds, ask them what the alternative, what's the alternative? What's happening in your shelter right now? Are your neonates already dying? What's the worst outcome? They are dying, right? So what is erythromycin going to do to them?
Maybe save them.
Maybe save their lives, you know. And if they do mutate to have some bug, you know, 10 years later to where azithromycin doesn't work, guess what? They lived for 10 years. They had a 10 years worth of life that we're giving up on them when they're only like 7 days old. So anyway, treat every symptom you see, please. And there are meds out there for every age group, every weight, everything out there. And I already talked about all in, all out. It's the same thing. You fill up your one room, and then as soon as they come in, you're hitting them out to foster. It's a pit stop. We are not creating another shelter for our kittens to live in, because what happens in shelters? Parvo, Panleuk, everything. It can't. If you're getting outside animals that you don't know where they're coming from, they're going to come in with something. So our biggest thing is just to make sure that we're protecting them and making sure that foster is always best. Because all I have to do is watch 5 kittens, right? That's all I got to do for 4 weeks. In the nursery, I have 150 kittens that I got to keep on every single day. It's so much easier for your fosters to take over for that.
So real quick, we're going to talk about pediatric surgery. We do feed our puppies and kittens before surgery. They are not fasted. They will get hypoglycemic and either take a really long time to wake up or not do well under anesthesia. So let them eat normally the night before, even the morning of. While they're waiting for surgery, we actually feed them a little bit of food beforehand. You don't want to stuff them, obviously, but we want to give them a little bit of something while they're in line. If you have a slow waker-upper post-op, try some dextrose, try some Cairo, try a little bit of gruel, and see. Usually that's the culprit. They're a little bit hypoglycemic, and so they're taking a little bit longer to wake up. You'll see most of your young animals are going to perk up after you do that. They do need to have a heat source. We have, so at Austin Pets Alive, we use V-troughs, and then we put a heating pad set to low under the V-trough, and then the blanket above the V-trough. So there's layers in between, but we don't want them to get cold while they're on the table, because that can be a problem. So no fasting, prevent hypoglycemia, don't let it happen, and make sure that they have a heat source, intra-op and post-op.
And the good thing about the little ones is that they're usually a quicker surgery, so they're not under for very long, so the heat loss, you know, isn't really that bad. So, if you have a good high volume spay neuter surgeon that's in there, they should be able to do one of these in less than 5 minutes, probably pups down or kittens down and then back up in no time.
Other common problems, so again, hypoglycemia, not just in surgery, they can get hypoglycemic at any time, especially small breeds. Your puppies that look like Lululemon, they're going to get very hypoglycemic. Any young puppies, if they're toy breed, they need to be fed like 4 times a day. If they miss a meal, that can be a problem. It can be very detrimental. So make sure they're being fed appropriately. 2 to 3 times a day, more if toy breed. Canned food for your young puppies, right? If you're in an open intake shelter and you're super, super busy and your staff are super busy, we still need to make sure that the young animals are being fed appropriately and have kibble that they can actually eat, and wet food. Bigger puppies don't need it as long. But really the biggest thing with these young guys is don't wait to treat. They really need quick treatment. We need to be aggressive with them because they don't have time. And so if the longer we wait, the more apt they are to not do well and have a good outcome. I'll let Dr. B talk a little bit more about that.
Well, I want to add just really fast. It's really important that at the shelter level, you guys understand that what you're feeding your adult cat or your adult dog is not what you can feed this population. You need to make sure that the kibble size is actually the right size. I've gone to plenty of shelters that tell me I'm feeding them puppy food, but they're feeding them just whatever puppy food got donated, and they're not making sure that this 4-week-old kitten has a teeny tiny piece of kibble versus a cat chow size of kibble. Also, I have a lot of shelters that I work at that tell me, well, we're feeding them gruel once a day. Kittens that are 4 weeks old need to have gruel constantly. It needs to be in front of them nonstop. One shelter that I had to go live at for several months, I just had gruel making parties, and we made it up in blenders, and we did happy hour 3 times a day and just ran through and poured gruel in kennels so that the kittens could all survive. So it's really important that that your staff understand that they cannot feed this population, but they feed the rest of the population.
And I have about 20 seconds, but anything under a pound and a half will fade if it's not eating. So if it's a 10-week-old kitten, a 3-month-old kitten, whatever it is, if it's under a pound and a half, it's supposed to be more like 3 pounds. If it's 3 months, something's wrong. If it's not eating, it's going to fade. So force feeding is huge every 4 hours for that kitten or puppy.
If you guys are interested in learning more about this, there's different classes that we offer at Austin Pets Alive. And we're available for questions.
Thank you.